Alright, so right now I'm outside the patient's room. My patient is Marvin Stewart. His date of birth 5/6/1955. He's going to be receiving the Indwelling catheter, 14 French catheter with a 10 ml balloon. And the reason why he needs this is because he's having trouble voiding. His bladder scan shows that he has greater than 400 milliliters of urine, and he is day 1 post-op after having a colectomy, and the physician ordered this Indwelling catheter. So now we're going to go ahead and enter the patient's room. Knock, knock. I'm going to close this curtain for patient privacy, okay? Hi, my name is McKenzie, and I'm going to be your student nurse for today. And today I'm going to be inserting a catheter. So the reason why you need this, Mr. Stewart, is because you've been having trouble voiding. And so you've had this procedure twice now, and it's going to be pretty similar, except for this time we're going to leave the catheter in, and it's going to drain urine from your bladder to the drainage bag. And this is a sterile technique, so if you can remain as still as possible. So really quick, I just want to make sure that everything matches up. So can you tell me your name as well as your date of birth? Marvin Stewart, 5/6/1955. Let me just check with this. Marvin Stewart, 5/6/1955. And do you have any other allergies besides ciprofloxacin? No? Okay. And are you allergic to iodine or latex? No? Okay, great. Alright, so I'm just going to start by getting you in the right position. Let me put on gloves really quick. Okay, so I'm just going to go ahead and lower the head of the bed. And then I'm also going to be raising it to a working height. Alright, Mr. Stewart, I'm just going to help you make you a little bit more comfortable here. Alright. Okay, so I'm going to go ahead and drape this down now, okay? And then I'm going to pull your gown up. Alright, so I'm just going to pull this gown up. Alright, so I would first start by doing peri-care. I want to get the patient into the dorsal recumbent position. And for testing purposes, I won't be draping him, but it would be important to drape his abdomen, legs, and his perineal area. So I'm going to put him in the dorsal recumbent position right now. And then I would perform perineal care by using warm soapy water, and I would start at the meatus and work around to the glands, and I would clean this area in circular motions, and I would use a clean part of a rag every time I did clean the area. Alright, so now I'm going to go ahead and get my sterile field ready. So I'm going to go ahead and take these off, get some hand sanitizer, and then I'm also going to get a piece of tape ready. This will be for later. Okay, now I'm going to go ahead and open up my packaging. I'm going to make this into a trash bag. And then I did touch the outer portion, so I'm just going to use hand hygiene one more time. Set this aside. Okay. Alright, so I want to be really careful with this. So I'm going to go ahead and open away from me, open away, away, and then over so I don't break the sterile field. And I can only touch the one outer inch. And then I'm going to go ahead and take this, and I'm going to want the plastic side to be facing me. So here I can see the plastic side. So now I'm going to go ahead and drape this and make sure not to go over it. As you can see, that's a little soiled, but for testing purposes, it's okay because that is from past uses. We do reuse things here at Cal State Fullerton. Alright, so now I'm going to go ahead and put on my sterile gloves. And I want to be really careful with this, only touching the outer portion. So I'm going to start by having my non-dominant hand grab here. And then I'm going to go ahead and slide my dominant hand inside. And then I'm going to take the cuff here and slide my hand in. Then I can go ahead and fix the cuffs once I have them both on. I'm going to do this. Then I'm not going to be using this drape here. I'm going to open up this cleanser, put it on my cotton balls. Then I'm going to go ahead and take the syringe here, and I'm going to be screwing it onto this port. I'll be taking off this wrapper for the catheter. And then I'm also going to be doing using some lube. And I'm going to be removing this urine cup. And then taking some lube and putting it in the corner. And then now I'm going to be transferring it over to the patient's bed. Alright, so I'm going to start by holding the shaft of the penis. And I'm going to be cleaning the area in circular motions from the meatus to the glans. Going around and dropping. And I have to make sure that the forceps doesn't touch the penis. Around, down, more, around, down, drop. Alright, so I won't be needing this anymore, so I'm going to set this aside. Now I'm going to be inserting the catheter. I'm going to dip 5 to 7 inches of lube for males, and then I'm going to use the mannequin lubricant here. Okay, now I'm going to go ahead and insert the catheter, and I can't let my sterile hand touch the penis, and I'm going to be inserting this all the way to bifurcation. Alright, now that it's at the bifurcation, I'm going to go ahead and take my non-sterile hand, and I'm going to inflate the balloon. Making sure my two hands do not touch. And that my fingers also don't touch the plunger. Alright, now that I have this in, I'm going to go ahead and take my sterile hand and unscrew it. I'm going to pull back so that I feel some resistance, until I feel some resistance. So there's resistance, so I'm going to go ahead and drape the patient for patient privacy and warmth. Alright, I'm going to go around and discard this with my non-sterile hand. I'm going to take my sterile hand and go ahead and hang this on the bedside. And I want to do it below. Okay. Now I'm going to go ahead and take these gloves off and throw them away. I'm going to put some new gloves on, and then I'm going to be taping the catheter to the inner thigh of the patient. So using my tape, put it right here. Okay, and then I'm going to go ahead and remove this stuff out of the way. And for testing purposes, I will not be throwing this away because we do reuse them. But in a real life situation, I would be very careful to discard all of this. So I'm going to set it here for now. I'm going to get the patient back and comfortable and relaxed to make sure that he has some privacy. Get this back on him. And then I would also be sure to lower the bed. And then as I can see here, during the procedure beforehand, I made sure that that bed rail was up the whole time, and that I have 3 bed rails. I can see all 3 are up. The bed is to the lowest point. I'm going to go ahead and throw away all my trash at this point, but as I mentioned earlier, for testing purposes, I will not be throwing it away. So I'm just going to go ahead and carefully set it all right here. And then I would discard my gloves at this point and do some hand hygiene. And then I would do my last safety check. So patient is Marvin Stewart. He has all 3 bed rails. His collar is located right there. I'm going to be back in 30 minutes to check on you. The bed is to the lowest point. He also has his personal belongings and bedside table located right here. So the patient is Marvin Stewart. His date of birth 5/6/1955. He just received a Foley catheter. He tolerated it well. It was a 14 French and a 10 ml balloon, and he received it on 9/27/2019 at 8 a.m.